Hey guys, so in this video I wanted to address a question that I got from one of you guys, and it was on the video titled Medical Assistant versus Medication Aid. And I just wanted to clarify, like when I do a video where it says one thing versus another, it doesn't necessarily mean that one is better than the other, because obviously a medical assistant and a medication aid are two totally different things. Um, but when I used that term versus, it wasn't like pitting them against each other or anything like that. It was just kind of me talking about one role versus the other. And so let me read the question here. I have it pulled up on my phone, and then I will address this question. So the question is from A. Ray, and it says, can medical assistants pass medication if under the supervision of a nurse or physician? So I actually have this page pulled up. Someone else in my medical assistant group on Facebook that I'm a part of actually asked this same thing, and that person asked if a medical assistant can give medications. And medical assistants are allowed to hand patients prescriptions, medications that are properly labeled and prepackaged, that have been ordered by a licensed physician, podiatrist, PA, which is physician assistant, nurse practitioner, or nurse midwife. And there are certain states, I'm not sure exactly which states, but if you're curious, I can make another video talking more about this in depth, where a certified medical assistant can actually give out medications in like assisted living or nursing home settings. So like I said, if you guys would be interested in that, let me know. I can make more videos talking more in depth about that. But now, according to a medical assistant scope of practice that I also found, at this time, there are no restrictions as to what type of medications a medical assistant is allowed to inject, because a lot of the times, like medical assistants don't necessarily give out a lot of like oral medications. They may give out like vaccinations, immunizations, things like that, but they do also inject medications. And that is what this part kind of pertains to. At this time, there are no restrictions as to what type of medications a medical assistant may inject, except anesthetic agents, as long as the medication has been pre-verified and the injection is either intradermal, which is under the skin, intramuscular, which is in the muscle, or like subcutaneous, which is just under the skin. So yes, to answer your question a little bit more from not like a policy that I found online, as medical assistants, you are trained to do certain things. So if you need to give somebody IV medications, for example, there may be certain restrictions based on your state. And I think it's important to look at like the medical assistant's scope of practice within your state, because there may be certain regulations from state to state that are a little bit different. For example, there are a couple of states that require you to be certified plus licensed in that state, but then there are also states where you just have to have your national certification and you can work like that. I was interviewing for a position when I first became a medical assistant at a hematology oncology clinic, and they would have trained me to do like IVs, and to do chemotherapy. But there was a stipulation with the chemotherapy where we could hang the bag and we could connect the lines to the IV or the port. But the nurse had to actually be there to start the medication itself. So we could connect the lines and we could hang the bag on the pole, but the nurse had to actually be there to witness them. Like they had to start the medication running through the lines, if that makes sense, to kind of watch and make sure they didn't have any negative reactions or things like that. So while a medical assistant is able to give medications and they are able to do injections and things like that, there may be certain restrictions. So obviously, as I just read, anesthetic medications, you might not be able to do that. And I should also state that medical assistants are usually allowed to do whatever it is that they've been trained to do. So if you work for a doctor who spends a little bit of extra time giving you additional training on a certain procedure or a certain technique or something like that, then you would be allowed to do that under his supervision or her supervision. Or their supervision, whatever the case may be. So I think it's just important to note that as long as you've been trained, you're usually allowed to do that. Again, it would depend on the scope of practice for a medical assistant within your state, because like I said, certain states can be different as far as what they allow and what they don't allow. And you obviously would have to be trained and able to proficiently perform the task that it is that you are wanting to do. So I hope that answered your questions. If you guys have any other questions like this, please let me know, and I would be glad to get something filmed for you. Also, if you have any questions to add to a future like Q&A type video, I do plan on making those once I have enough questions accumulated. So stay tuned for that. And also, like I said, if you have any questions, let me know. Leave them either on the community tab on my channel or in the comments. And yeah. If you guys have any other topics you'd like me to talk about on a future video on my channel, please let me know that as well, and I'd be glad to get something filmed for you. And with that being said, I will talk to you guys next time.